Hi everyone, this is Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness, and I do apologize for all the technology issues that I've been having with Facebook Live. We are going to talk today about how to make an ice cup for ice massage, and because I'm not quite sure where it interrupted, I'm actually going to just start back at the beginning. The reason that we do ice massage is because we want to decrease inflammation, we want to decrease pain, we want to decrease muscle spasms, and we want to look at localized areas that are kind of wreaking havoc with our body. So the difference between using an ice pack and an ice massage is exactly that. An ice pack you're going to use in a global or diffuse area, a larger area such as a knee, a shoulder, a low back region. Whereas ice massage you're going to use on a smaller area. For example, tennis elbow on the outside of the elbow or golfer's elbow on the inside of the elbow. You might also use this for patellar tendinitis of the knee or Achilles tendinitis of the foot and ankle. Now, with ice massage, we want to look at when is the appropriate time to apply it. And it follows the same rules as applying an ice pack. So in the first 0 to 4 days following an injury, you can apply ice massage if the area is a small area. If it's a large area, you want to go ahead and use a larger ice pack. Same thing for like a subacute area or following an injury, which would be 5 to 14 days after an injury. Again, we're going to keep applying ice and ice massage to a small area to decrease inflammation, decrease circulation, and also decrease muscle spasms and pain in that region. As you move farther away from an injury, for example, like a post-acute care phase, which would be after 14 days, or if it's a chronic issue, you can start to implement some heat, but I would recommend applying heat to warm up an area, allow for good stretching, and then ending with ice as well to, again, reduce circulation, reduce muscle spasms, and reduce pain. Now, when should you not use ice or ice massage? If a person has a cold sensitivity or has been diagnosed with Raynaud's disease, they should not use ice. If the area is compromised for circulation or has limited blood flow, you don't want to apply ice to that area. If a person has decreased sensation, numbness, tingling in the area, you don't want to apply ice because they cannot feel if they're going to have frostbite. The other thing is that is different than an ice pack is an ice pack you do not apply ice directly to the skin. With ice massage, you do apply it directly to the skin. Now, how do you make a homemade ice cup? Well, let me look in here on the freezer, and you're basically going to take a Dixie cup, just that you buy at the store. You're going to fill that with water, and then you're going to freeze it. You typically fill it about 3/4 of the way full. Then what you do is you tear down the edges of the cup. I've already have one pre-made. So you tear down the edges of the cup, and I like to leave a little bit of that cup so that my hand doesn't get cold during the application of it. The next thing that you're going to do is set up a towel, because this can get a little bit messy, and you just place, let's just say we're doing a tennis elbow, and I'm going to adjust this a little bit so we can see more. Okay. If I'm doing tennis elbow, I'm going to go in a circular motion along my skin, and you always keep the ice massage moving. You don't want to stop and hold it stationary. This generally is going to take about 3 to 5 minutes because the areas tend to be a little bonier than other areas that you might apply an ice pack to. So you keep applying in a circular motion, and what the person is going to feel first is cold, intense cold, then it might burn, and then it's going to go numb. When it goes numb, you stop. So you can kind of test the area with your finger. And if you can't feel your finger, then you're going to go ahead and stop the ice massage so you don't put frostbite into that area. Generally speaking, this is about 3 to 5 minutes. The longest I've ever gone with an ice massage would be about 8 minutes. But beyond that, it's really not as time consuming as applying ice for a 20 to 30 minute time. If you're applying ice massage to shin splints or to an ankle, the same rules apply. You want to go in a circular motion, or you may actually go on shin splints up and down. The key is to keep that ice massage moving. When you're finished, you just wipe the area with the towel, and then you throw the ice block into the sink, and then throw your ice cup into the garbage. Make sure that you have about 5 ice cups ready in the freezer. So every time you use one, I recommend replacing it with another one so that you have a good 3 to 5 ice cups ready to be used so you don't run out, especially if you're applying ice massage frequently throughout the day. I hope this is helpful. Again, we're going to use ice massage for small areas, for areas like that have tendinitis or inflammation in them, but are small regions. And you're going to use ice packs for larger areas such as knees, shoulders, and backs. Thank you very much. I look forward to hearing from you, and your feedback, just go ahead and put into the comment section. Have a great day.